Hey guys! So I just finished the first day at the Board of Trustees meeting for this month, and I wanted to give you an update on what to be talked about. This meeting was actually highly pertinent to the students, and they actually had a lot of questions for us that we're going to need to talk about in our September meeting so that I can report back to them in October before the House of Delegates. So the first item on the order of business today was the barriers to care workforce. Most of you guys were able to attend the webinar or have heard some information about the Policy Development Committee's proposal, which will be given to everybody at the House and asked for approval on that. The goal of the Policy Development Committee when addressing these barriers to care were to target the underserved while still preserving private practice. And so throughout the summer, members of the Board of Trustees have been trying to figure out various ways to communicate to members what the actual proposal is, and I have it right here, and if any of you guys want a copy of it, just let me know, but it's really thick thing right here. So they put a lot of work into this, and like I talked about in the video update before, there's nothing like this that has been done. So one of the questions that they had for us and that most of the members are concerned about is the proposal for a PGY1, a year of residency training after dental school to help address the access to care issue and also as a way for student dentists to get their license. Basically, they would like to know what the students' opinion of this is. So far, most of the students that I've talked to are in favor of this. We also want to know how that interacts with portfolio licensure. So they asked myself and Dr. Christy Rollifson, who is the chair of the Committee on the New Dentist, for her opinion, and the Committee on the New Dentist is in support of PGY1. So we need to talk about this at the September meeting. So please ask around, ask your classmates, start talking about how they feel about the barriers to care because they really want the students' opinion on this. New dentists are the way to fix this problem by encouraging more dentists to work in public health areas and also addressing dental and dental benefit reimbursement for dentists, but all of this starts with our generation, so they really want to know our opinion. Okay, the next order of business is the financial institution governance structure. Basically, CDA is talking about the possibility of becoming a lending institution or a bank, basically, to give out loans. That has not been addressed, and that is not what we are voting on right now, but there is discussion about that, which is really exciting. So in order to do that, there are some legal implications that CDA must change in order to prepare for the possibility of becoming a lending institution. So this next part that we talked about was just addressing the bylaws, having non-CDA employees as well as CDA employees oversee the financial institution. So that was approved. The next thing that we approved was funding for an oral health care curriculum. Basically, a doctor up here in Northern California, Dr. Patel, created an oral health curriculum to be presented to medical personnel to relate oral health to systemic health. So basically, she wanted to take this presentation around and present some of the implications that doctors might see in the hospitals and how that relates to their oral health. And so CDA was approving $3,000 for her to provide lunch because you know that no matter how good the presentation is, food will always bring people there. So I think that's a great idea, and hopefully that can continue or spread to more areas in California based on how that goes. Alright, the next thing that was approved is called the Powerhouse Science Center. Basically $25,000 was given to a museum that's being built here in Sacramento. It's an innovative educational center, a museum, restaurant, conference center, and planetarium. It's going to be right here on the Sacramento River, and they're going to have a section dedicated to dentistry. So the goal of this, reason why CDA decided to support this, was to support children learning about dentistry at a younger age and hopefully get them excited about it. And that also is helpful to our barriers to care, because the more education that we have, more opportunities, the better that chance we have of having good oral health in California. So this $25,000 makes us a founding member and allows us to be on the committee that decides what exhibits get put into the center. So we have a pretty big stake in that, which is exciting. Okay, next big thing for us, the CDA Foundation funding strategy. Okay, so due to the economy, a lot of grants that were helpful with the CDA Foundation have dried up. And actually, unfortunately, CDA has had to do quite a bit of belt tightening because they have a $1 million deficit in some of the areas of their budget. And so this has actually led to having to let 4 very trusted employees go because there was no more grants to pay for them. So the CDA Foundation needs to turn around and needs to get back on their feet. So they have asked for CDA to donate $350,000 to the CDA Foundation so that they continue doing their charitable works, providing scholarships for students, loan repayment programs, Give Kids a Smile, all of the projects that reach out to the community and also to help give back to us. Basically, this would be the first of a 3-year proposal, so they're only asking for $350,000 of their $1 million deficit, and then they'll reevaluate next year because there possibly could be some money from some other sources. So there's quite a bit of debate on this one, but I actually spoke in support of this from the student delegation, and my thoughts were, I think that our generation of student dentists are pretty service-oriented. And the things that the CDA Foundation does, I think as a student body we support. The CDA Foundation also gives back quite a bit to our generation in terms of scholarships, loan repayment, and just supporting us in general. And so I think that the CDA Foundation, besides TDIC and CDA Presents, is one of the main things that can get our generation of students to join CDA. And so I spoke in support of this, and I hope you guys will too, but we need to talk about this in September, definitely. One of the examples of how the CDA Foundation has had to tighten their belts is that they could only provide 1 loan repayment grant instead of 2 this year, which is a big deal for addressing the barriers to care issue, and that directly affects those of us who are graduating and wanting to work in public areas. So the better that the CDA Foundation does, the more they can help the new students and the student dentists, as well as reach out to those in need in California. Something that didn't require an approval but was just a recommendation was a recommendation to create a task force to look into dental benefit plans and find ways to enhance the position of dental providers in relationship with these plans. Basically, this is to be proactive in member concerns. A lot of member concerns in terms of advocacy have to deal with insurance companies and dental reimbursement. So there's just a task force that's going to look into this and find out how we can create ways to make that a better relationship. Okay, some of the smaller things, but also things that affect us, we approved a merger between the California Dental Hygiene Association and the California Dental Association at the table clinics at the CDA Presents in Anaheim. So during the table clinics, the CDA, the dental students have their table clinic research competition in the convention center, and the California Dental Hygiene Association have it in the Sheraton across the street. So they'll still keep the separate locations, but now they want to send the CDA judges over to the California Dental Hygiene Association, and also for those hygiene awards they'll have the CDA logo, which is just a bigger deal to them, and also provide some collaboration between the two groups. And CDA will also give some awards to the hygiene contestants. Okay, so we have a new Committee on the New Dentist student representative from UCSF, and we actually had some trouble this year because the previous rule was that Committee on the New Dentist rep alternated each year between the northern schools and the southern schools. But now that we have 4 schools down in Southern California and 2 in Northern California, and also with the difference in student schedule and with UOP only being 3 years, it kind of creates some disparity in like fairness for allowing whoever is interested in running for the position to run. So instead of rotating between the North and the South, we're going to have a 2-year term max for the Committee on the New Dentist rep, and they'll just choose the best applicants from any of the schools each year. And they're going to try really hard to not keep the representative from the same school. But, for example, this year we had about 7 people interested from Southern California who weren't allowed to apply, and only 1 applicant was interested from Northern California. So that is a new rule just to allow anybody who's willing or interested in taking that position to be able to apply. So that's exciting for us. Okay, sleep disordered breathing position. We talked about a resolution that supported legislation to ensure that whether a doctor or a dentist could order diagnostic tests and render patient care for people with sleep apnea. Now, this resolution talked about sleep apnea is a medical condition. So dentists can screen for it, but they can't diagnose. Sleep apnea is related to heart attacks and strokes, so this is out of scope of the dentistry to diagnosis. However, dentists need to be able to work with doctors to treat this, making occlusal guards and some anterior repositioning devices. And so this resolution says it is appropriate for dentists to screen for sleep apnea, just how when you take vitals you screen for high blood pressure. And then we want to make sure that reimbursement, the health care reimbursements, because usually Medi-Cal pays or Medicare benefits pay for these sleep apnea tests. So whether a dentist or a doctor asks for these tests to be done, we want to make sure that the patient is covered by their health care. So there was some discussion on this because there is actually a loophole where dentists can abuse this system and get Medicare reimbursement for diagnosing. And so this resolution is referred back to the PDC for reworking of it, but we should still see it come up at the House to vote on. The last report given was from the General Counsel, and Allison Sandman just gave us an update on some of the issues going on right now. In North Carolina, some of the dentists in the Dental Association were giving cease and desist orders to some of the commercial teeth bleaching companies. So teeth bleaching that's being done in the malls and like vendors and fairs. They argue that this was out of their scope of practice and that a dentist needs to be able to take care of this. The FTC actually ruled this as anti-competitive, and the dentist lost. However, North Carolina is appealing this issue, and so we'll see how that goes with the teeth bleaching issue. In Santa Ana, the Green Dental Work No Amalgam resolution basically said that Santa Ana is a mercury-free dentistry city, and this was also passed by Costa Mesa a few months ago. So a lot of dentists are worried that the city councils are getting together and deciding that their city is going to be mercury-free. A lot of this comes from just public paranoia and has no legal implications. So even though these cities say that they're mercury-free dentistry, that doesn't mean that dentists in that area can't use amalgam. But it does create a public relations issue, and so CDA is working actively to monitor city council agendas in that area and work hard to just ensure that the public understands and is educated about the use of amalgam. Other than that, we just talked about a couple other things about CalDPAC and the issue of the open primaries that I'll be bringing more information to you guys soon. But thanks for listening to the update, and I'll see you guys all in September.